close to 2 weeks of Unlock 1.0, and the initial concerns are that is the unlocking of the economy, of the movement of people in India, leading to a big surge in the numbers. Now, this was part of the discussion of day one of a meeting between the Prime Minister and Chief Ministers of various states. These meetings will take place over the next 2 days, and in the beginning of today's meet, the Prime Minister focused once more on the low mortality numbers that India has. Fewer people have died as opposed to the amount of population we have when you compare it to the rest of the world. And that really has been the key takeaway, the key solace as we've seen the numbers growing. Of course, in this series of meetings, we will have a lot of demands coming in from states, a sort of status check on how states are managing things as well. So we're going to talk today about India's COVID numbers and the handling of COVID as we begin to unlock. But before we move ahead, let me just get in a quick word from my colleague Ruchi Bhatia, who's been tracking that PMCM meet. Ruchi, today was day one. What was the key highlight and the key demands that came in from the states?
Prime Minister Narendra Modi today set the tone in his meeting with state chief ministers, talked about how we need to focus on livelihood while boosting health infrastructure, testing as well as tracing with respect to coronavirus as well. He also reiterated how the new normal will be very different, the one where we will have to wear masks and gloves when we step out of our homes, but we will have to focus on continuing to push economic activity as well. The Prime Minister saying the green shoots of recovery are visible in the Indian economy, so much so that we have seen how power consumption, how two-wheeler production as well as a toll collection is back to the pre-COVID levels, and in the days to come steps should be taken to ensure that the economic activity continues to go in and move in a good manner. Having said that, the Prime Minister once again reiterating that India's recovery rate is far higher than other countries. We've surpassed 50% in terms of our recovery rate, and the chief ministers, he has asked chief ministers to provide the central government with the on-ground situation and the steps that are needed to augment health infrastructure. We're also given to understand various states have raised concerns with respect to and have asked the centre to provide them with more testing facilities as well as more funds to boost and augment health infrastructure. This meeting is going to continue tomorrow as well and will be an important one to watch out for, because this will really guide the way things are for the Indian economy. One thing is very clear: we cannot afford another lockdown as far as our economy is concerned, and the new normal will be very, very different.
You know, another reason people are watching the meetings is the rumor mill swirling over the last few days that there will be another round of lockdowns. Several chief ministers have come and clarified that's not the case, though Tamil Nadu has imposed some form of lockdown in the city of Chennai till the 30th of June. So it's a wait and watch situation overall. Meanwhile, we're at close to 3.5 lakh cases, close to 10,000 deaths here in India, but the recovery rate, as Ruchi was mentioning, has been good. So where do we stand? Speaking to us today is Dr. Ashish Jha, who's director at Harvard Global Health Institute, Harvard University. Great to have you on the show, Dr. Jha. I'm also speaking with Dhrubabrata Ghosh Dastidar, who's the director data and analytics at Protiviti, India. Dhruba, great to have you back on the show as well. Dr. Jha, let me just start by getting your view on Unlock 1.0 and how it has gone. Through the months of April, May, the conversation was lives versus livelihoods. We've chosen livelihoods. What about the lives?
Yeah, so thank you for having me on. I have to start by saying I'm concerned about where India is right now. We're starting to see large increases in the number of cases every day. And India is now number 3 in the world in terms of number of new cases, top 5 in terms of total cases. And, you know, I understand that people are looking at death rates, and death rates obviously are very important, but they tend to be a lagging indicator. They come many weeks. The deaths increase many weeks after the cases do. So I would not yet feel very optimistic that India will have a low death rate. Of course, I hope it does, but we don't know yet.
What about the recovery rates of over 50% that have been spoken about? Explain to us what that means, and should we draw some comfort from that?
Yeah, this is very puzzling to me, to be very honest. Nobody I know who's a serious scholar of this virus or of pandemics is looking at the recovery rate as a meaningful measure. And let me say why. We think 99% of people who get this infection will recover. So a recovery rate over 50%. It doesn't, this is not a disease that kills 100% of the people or 50%. It kills about 1% of the people. So a recovery rate right now is just not a very useful number. And I don't take any solace or comfort in that right now. The key issues to be watching are number of cases, number of deaths, and overall mortality rate of the disease. Those are the major metrics, and how quickly they are moving over time. That's the most important issue, because the virus can grow very, very quickly in numbers and can very quickly overwhelm populations. So we have to track that very carefully.
So what are the, when you said right in the beginning of, your first answer, Dr. Jha, that you're a little worried about where India is right now. So what are the statistics that are worrying you specifically?
Basically, how quickly the number of new cases is rising, and yet it has not. I mean, it's obviously a lot of that is in Mumbai and Delhi and Gujarat, Chennai, kind of major metropolitan centers. So there are a few things that are worrying me. First is that as India has come out of the lockdown, and I was supportive of the lockdown, I think it was the right thing to do. But as India has come out of the lockdown, it is not clear to me that there's a very good plan for how to keep this virus under control. It's worth remembering we are probably a year away from this pandemic coming to an end. So India really needs a very detailed plan for what to do over the next 12 months to control the virus. Second is number of cases is rising really quite quickly. And it's very quick that India has now jumped into the top 5 in the world in terms of number of new cases. And then last, is there are major centers, major population areas, Bihar, UP, other places, that have not gotten hit very hard yet. And I am very worried that as the virus spreads across the rest of the country, when it comes to UP, when it comes to Bihar and Jharkhand and those places, that they're going to have so little capacity to manage it that we're going to see a large increase in both cases and deaths. That's what I'm worried about. And we need a plan to prevent that.
Yeah. Let me come to Dhrubo. Dhrubo, now Protiviti has been doing some excellent work in forecasting and looking at how various states have been handling the COVID-19, and that's important because this is a large country and each state seems to be, and each city actually seems to be having its own story unfold. What's your latest data telling you, and is this concern of the virus moving beyond Mumbai, Delhi, a very serious one? Right now, all the focus seems to be on Delhi, where it was on Mumbai 2 weeks ago.
Right. So if you look at the numbers, definitely Bombay was hard hit. Right now it's Delhi. And we also see Chennai to be another city which is getting hit badly on a day-to-day basis. But as Dr. Jha said, right, it has not still shown indicators in places like UP or Bihar. Once that starts, it would be something to be watching out for. Right now, all the indicators which are there shows that the disease is in control. But we have seen how quickly that can change for Tamil Nadu, which was initially showing a downward trend and suddenly picked up after the initial few weeks. Delhi is also similar. It seemed that it was in control and suddenly it kind of picked up. So we have to be mindful. A particular state or a city doing okay right now doesn't necessarily mean that it will be doing the same going forward. Looking at the cities to watch out for right now is definitely Bombay, to a large extent Pune as well, Chennai and Delhi. Bangalore seems to be doing okay. Calcutta is more or less in the middle zone. So that's how the cities are doing right now. The rest, it's kind of time to be cautious for.
I want to understand how this translates into the policy measures that have been taken. Dr. Jha, you've been speaking about, the concerns of the virus spreading into deeper into India, beyond the cities, etc. But all of the migration that has taken place, or a large part of it, and what we're told is that there was very effective screening, people were put into quarantine, there have been rules of quarantine for those traveling by flights, those in the special Shramik trains as well. Wouldn't all of that have helped at some point? And I want to understand where we seem to be lacking in terms of administration. If we're seeing a lull in cases and then another explosion, we've had a nearly 3-month lockdown.
Yeah, so I do think, first of all, those measures probably helped some. But this virus is very, very, very difficult to contain. And so the idea that those measures of temperature screening somehow and other quarantine things somehow completely stopped the spread of this virus into other parts of the country, I think is not realistic. And what is going to happen is that, so I think most of these states have gotten some number of cases, and they will grow over time. And we will then start seeing large outbreaks in many other parts of the country. This has been the reality of every other country that has dealt with this. China had a very, very aggressive approach, and yet just in the last day, they've had now a new large outbreak in Beijing. This is going to be the reality of fighting this virus for the next 12 months. We're going to continue battling it. And we want to use as much data, evidence, and science to drive those decisions. And one of the things I remain worried about is that India has made real progress, but not nearly enough in terms of its testing capacity. So it needs to really do a lot more on testing and tracing as one of the major mechanisms for virus control.
But Dr. Jha, the other problem is that, yes, testing has to be ramped up aggressively. We've spoken about that on this show several times as well. They've promised to increase testing to 18,000 a day in Delhi from 7,000 odd. But where are the medical facilities? Increased tests also will mean increased detection of cases, possibly increased number of patients who would need medical facilities, which already seem to be wafer thin.
First of all, most people who get diagnosed do not need to be in the hospital, right? That's not what they need. What we believe from all the data from Europe, from the United States, from China, East Asia, is that probably only 5 to 10% of people who are infected need to be hospitalized. So the reason to identify the other people is so they can be quarantined and they can have tracing of their contacts. That's why you want to identify all those other people. And you only need to put into hospital maybe 5 to 10% of the people who are pretty sick, who need hospital care. They need oxygen, they need other types of therapies. So we want to be increasing diagnoses, but those people then need to be quarantined. They don't need to be in the hospital.
Okay. Dhrubo, I want to understand in terms of how various cities and how various states are dealing with it. We know that this 2-day meet is on where Chief Minister also figuring it out. How many states are seriously looking at testing, contact tracing and identifying, people who could be positive in all earnest? Is that where the glaring hole sort of is?
If you look at the study, it's based on the data which is reported. It's very hard to tell what the number of tests being conducted on the ground, right? Yes, there are different stories which says in certain cities or states the testing has gone down. Definitely it's something to worry about. More tests would result in more number of cases, and it actually will help in identifying and understand where the next kind of a hotspot might arise. But whether it's happening or not, it's very difficult to trace from closed doors, right? So definitely there are some glaring holes in the entire process, and we have to figure out how we get the exact numbers to identify where we should focus our attention into. But if you look at the numbers, certain good things which has happened for Bombay, at least the numbers have stabilized, whereas in Delhi it has kind of vacillated. It has gone up and gone down, both in the number of testing. I believe Maharashtra or Bombay had kept a constant number of testing. It should have been increased, but I believe that the number of tests that they do is more or less constant from the time the virus have kind of crept in. Whereas for other cities, I believe we can increase the number of tests, or we should increase the number of tests.
Yeah, I mean, hopefully there will be more policy focus on that. Dr. Jha, I want to understand the concerns of a second wave and how real they are. We've seen those concerns in the United States. We've seen these reports from Beijing, which are very, very worrying. What do we know about this right now? And does it, give us the idea that a second wave is more likely rather than less, pretty much everywhere?
Yeah, so India is still, I would say, in its first wave. So second wave is really an issue, I think, for countries that have kind of gotten over their first wave, and that's Western Europe, a little bit the United States, but in the United States also still in its first wave because it didn't really do a good job of bringing the virus under control. The idea of a second wave is once you get the virus under control and you bring the number of cases way, way down, the virus isn't gone. And people are worried that in the fall season, when the temperature starts getting cooler, people start spending more time indoors. That's when you're going to start seeing an even bigger spike in cases. That's the idea of a second wave. For me, India, as I look at the India data, I think, first of all, we've got to get this first wave done. We've got to get it to this exponential rise. We're seeing this incredible growth in cases. We want to see that stop and ideally come down. And then we can worry about how do we prevent that second wave where the number of cases starts rising again.
No, absolutely. I understand what you're saying, Dr. Jahan. I agree completely. We have to first figure out where our peak is and then, get over that and then look at a second wave. But I'm talking in the broader perspective. We hear today that New Zealand, which was completely COVID-free, has now reported new cases. My question is it fair or would it be correct to say that a recurrence is more likely rather than less likely in any place?
Yeah, to answer your question very directly, absolutely. A recurrence is very likely, even under the best of circumstances. And New Zealand has done pretty much the best job in the world, or certainly one of the best. And even there, they're starting to get some recurrences. This is going to be the ongoing challenge of this virus, that when you get it under control, you can't let go, you can't let up, because the moment you do it, the number of cases will start rising again. So it's going to be an ongoing battle until we have a safe and effective vaccine that is widely available, which is probably about a year away.
Absolutely. That's the key question. Meanwhile, how do we deal with it? How do we deal with it with clarity, with easy to follow set of rules across the country while keeping local requirements in mind? How do we have sort of a cooperation between center and state? These are important questions that we'll have to see over the days to come. Dr. Jha, thank you so much for joining us. Dhrubo, great to have you on the show once again. One example of how clear policy making is crucial to dealing with normalizing of life after coronavirus is what's happening with education policies. Every state seems to have their own version. In one state, no virtual live classes are allowed till grade 7. In one state, the no classes virtual are allowed till grade 2. The center wants to come up with its own SOP. It's not clear whether board exams will take place or not. It differs from one state to the other. It's chaos and confusion. We're going to take a very short break, but when we come back, we'll bringing you a special report on how this chaos and confusion is causing real stress for parents and students.